On the leadership skills questionnaire, I've got a 26 on administrative skills, 25 on interpersonal skills, and 26 on conceptual skills. Um, we use a shared governance at the hospital that I currently am employed at. The staff are aware of most of our decisions that are made. Decisions are made up of a consensus of staff, and that includes many of the different areas such as lab, even safety, or the respiratory therapist, the physical therapist department, emergency departments. Every one of those actually works together. Areas that I might need help with are the planning and organizing of leadership. I think that would be probably my worst areas that I have is organizing and planning. Kind of a spur of the moment procrastinator. Um, the article that I looked up was Resistance to Change in the Nursing Profession by Carrie S. Clark. And using this article, it would help out on the floor that I work on, which is a med-surg floor. It is functional nursing is what we use on the floor right now, where we'd have a charge nurse and several other nurses along with CNAs and secretaries. Not really one of them is a team lead, which that's the kind of concept they're trying to go for on med-surg. They have started this in ICU, but it has not worked its way up to med-surg yet. You kind of use this article as a framework of for creating the team nursing concept of the floor and creating that moment of which she actually talked about, as far as like actually getting the staff to understand that there are certain issues that are aware on the floors when we don't have a nursing supervisor, that we need a strong charge nurse or we need that team lead nurse to actually take care of patient satisfaction and some other areas, as far as that happen when there is a consistency with a 1-to-7 nurse patient ratio, um, where we have like the CNAs have 1-to-9. This can get to very, very too much of a headache if we have a crisis or a code or anything like that. And having that team lead nurse actually helps because they actually have up to 3 patients, if not less, depending on the staff and the patients that we have on the floor or their needs. Um, let me see. Decreasing that resistance for that staff to change. This article actually was pretty good as far as learning the different modules and how to decrease the resistance to staffing. Um, right now, the hospital kind of has both the horizontal and the vertical. I prefer the horizontal because of the need for different departments to collaborate as a one organized unit. That actually probably would work better as far as a particular area of management. Let me see. And then the levels that we work in, we work with our nursing floor staff, physical therapy, respiratory department, and emergency department. As long with we each at say certain times of the day. Well, basically on days you'd have one time during the day that we would have a case management meeting at the end of the hall or wherever, and each nurse goes over every one of their patients. and it's nurse led, not physician led, but nurse led, to save the time. But we have case managers, physicians, and house supervisors that each one of them attend these meetings. It actually rolls really smoothly on the floor. Um, so, those are about basically the areas that we work with, or that I work with, to be effective. It's almost basically the entire hospital, so it's kind of a um, more of a horizontal area. As long as these areas are working together with the nurses and the staff, it actually goes for a better day. So, anyway, that's it. Thanks.